Hi, my name is David Emerson. I'm a long-term myeloma survivor, myeloma cancer coach, and director of People Beating Cancer. Welcome to my vlog post regarding a dangerous side effect of chemotherapy called chemotherapy-induced cardiomyopathy and hypertension. The science, the research is pretty clear on this, on the general topic that a host of chemotherapy regimens can damage the heart. Specifically, chemotherapy's alkylating agents, those would be cyclophosphamide, busulfan, melphalan, all three of which I underwent back in the 90s. Platinum-based therapies, cisplatin, carboplatin, others, proteasome inhibitors, bortezomib, carfilzomib, specifically for myeloma patients, my cancer. So the science is fairly well established. What is not well established is the prevalence of cardiomyopathy, heart damage, as a short-term or long-term months, years, versus a late-stage side effect. I mention this because in my case, approximately 15 years after my induction chemotherapy and autologous stem cell transplant, I woke up one day and my heart flipped into atrial fibrillation, chronic 24/7 atrial fibrillation. That was approximately 2010, late 2010. Since then, I initially tried, I went to my cardiologist. He confirmed the diagnosis. He confirmed the problem, though he didn't really know what to do other than to prescribe normal heart meds. I think metoprolol was the therapy that he put me on. After a day or two, I could barely breathe. I had trouble sleeping. I didn't like it. Took myself off, and then went about what I always do, which is research non-toxic, evidence-based, non-toxic therapies. And truth be told, since then, it's been more than 10 years now. My ejection fraction, which was at the time approximately 35%, is now up to 50-55% ejection fraction. My hypertension, I was up around 140 over 90. I've now come back into the normal range, 120 over 80. All to say, I manage my heart health with a host of therapies, everything from CoQ10, which is quite well studied, even there's certain forms of nutrition, moderate but daily exercise. There are a number of therapies. And the key, very important to remember, you can undergo therapies before chemotherapy, cardiotoxic chemotherapy, that will reduce your risk, perhaps even eliminate your risk of heart damage. Or immediately following, you can exercise and build many of these supplements into your routine to minimize your risks, perhaps even to heal your heart damage. All to say, if you want more information on the non-toxic therapies that I undergo, heart healthy therapies, nutritional supplementation, lifestyle, feel free to email me. Scroll down the page, send me an email. I will reply to you ASAP. In the meantime, thank you and be well.